Senate Republicans gearing up for a fight to replace Obamacare, and not just with their peers across the aisle. For a second night in a row, late-night comedian Jimmy Kimmel launched a personally tinged attack against the Graham-Cassidy health care bill and its author. Watch.
I took him to task for promising to my face that he would oppose any health care plan that allowed insurance companies to turn people with pre-existing conditions away, and any health care plan that had an annual or lifetime cap on how much they would pay out for medical care. He said anything he supported would have to pass what he named the Jimmy Kimmel test, which was fine. It was good. But unfortunately and puzzlingly, he proposed a bill that would allow states to do all the things he said he would not let them do. He made a total about face, which means he either doesn't understand his own bill or he lied to me. It's as simple as that. So today, it was a bad morning for Senator Cassidy. He and his co-sponsor, Lindsey Graham, spent the morning defending the indefensible. This morning, the senator sat for an interview with Chris Cuomo of CNN and pulled the all comedians are dummies card. There's a new Jimmy Kimmel test for you. It's called a lie detector test. You're welcome to stop by the studio and take it anytime.
Harsh words, not apparently in jest. And joining us now is Senator Bill Cassidy. What is your response, Senator?
I'm sorry, he does not understand.
Oh, I get it. I don't understand because I'm a talk show host, right? Well, and then help me out. Which part don't I understand? Is it the part where you cut $243 billion from federal health care assistance?
All right. So here now, the target of Mr. Kimmel's ire, Senator Bill Cassidy, who's also a doctor. Senator, good to see you tonight. Thank you for being here. So that, you know, I guess, first of all, you know, what's your response? You know, obviously you guys are now fighting this out on national television.
I'm totally not fighting. I actually wish that Jimmy would actually maybe hear my perspective. And not, I apologize if I offended, but I don't intend to. For example, he says that we kick everybody off the program in 10 years. In Washington, you have to reauthorize a program. The people that want to keep Obamacare keep putting this misinformation out, but you have to reauthorize. As an example, the children's health insurance program we're going through has to be reauthorized. Technically, it could end. In reality, it will not. Similarly, this going through the CHIP program has to be reauthorized. You could say, well, it stops in 10 years. No, it has to be reauthorized. His concern that those folks will be kicked off of coverage is not a concern.
All right. You know, let's put up the fact check that we sort of put together to take a look at here with you tonight. Are there $243 billion in cuts from the federal government? Is that number true?
You know, I don't have the exact total, but let me say we spend less than Obamacare. We repeal the penalties on those who do not, the individual mandate penalties, where the federal government tells people, if you don't purchase insurance, then we are going to penalize you. Turns out 60% of those folks who, 60% of the people who pay that penalty earn less than $50,000 a year on their IRS form. 60% earn less than $50,000 a year. Now, we can penalize them, get a little bit more money. I think we should be helping those folks, not penalizing them. So, yes, we spend less money. I make no apologies, but we spend over $1.2 trillion in the last 5 years alone.
Now, you're a physician. Your wife is also a physician. She was the head of surgery at a facility that you both were at in Louisiana. You started a clinic to try to provide more health care for lower-income people. So, you know, personally, how do you feel about where you are right now in this process and having someone accuse you of creating a program where, for example, if a child has a heart condition and then they need surgeries over the course of their lives, they're just going to be left out in the cold?
One, I respect that Mr. Kimmel is passionate about the issue. His child might have died on the day of birth. I understand his concern. I have that concern. As much as he doesn't want to think that, you can look at my life's work, 25 years in a public hospital for the uninsured, working in prisons, setting up free clinics, etc. My life gives testament to that. And by the way, because of this bill, there will be so many more people in states like Florida, Utah, Tennessee, Missouri, Maine, Virginia that have access to health insurance who do not have it now. And that child who needs heart surgery will have coverage because of this bill. Again, Maine, Virginia, North Carolina, Missouri. Are we not to care about them? I care about them. By the way, we do good things for states with 2 Democratic senators. This is not partisan. It's about patients.
What about, let me ask one more specific question that he talked about last night, which is whether or not there's a lifetime cap, or an annual cap, that you could be treating a child like this and the insurance company is going to say, I'm sorry, you can't come back for your appointment next week because you've already hit your cap. Is that going to happen or not?
It's not. We base it upon the Children's Health Insurance Program, which everybody loves. Both Democrats, Republicans like the Children's Health Insurance Program, and we have the same benefits as in the Children's Health Insurance Program.
But you're asking the states to take on that responsibility now. So I guess in this scenario, he's suggesting that once the state is in charge, they're going to make decisions based on what's best for them. And then in that case, that could happen. Could that happen at the state level under your bill?
If a state wants to do something different than what our bill says, they have to come to the federal government, the Secretary of HHS, and show that those with pre-existing conditions shall have access to adequate and affordable coverage. Someone says, well, what does affordable mean? When I look it up, it says able to afford. Let me contrast that, by the way. I have a friend with a pre-existing condition in his family. He's paying $32,000 a year with a deductible on top of it. Another friend whose premium was, it's on my Facebook page, $39,000 a year.
Yeah.
This is not affordable. The idea that status quo takes care of people in kind of the middle class is wrong.
All right, Senator, maybe you should give him a call, and you guys should talk this out. Thank you very much. Have you done that, by the way? Have you reached out to him?
You know, we talked about it, but frankly, I don't think Jimmy wants to talk.
All right, well,
he's hard to reach.
Jimmy,
but by
give
the
him
way,
a call.
if he wants to talk, we should talk.
All right, well, there you go. We'll see what happens. Thank you very much, Senator. Good to see you tonight.